Sleep apnea is a big problem. It's actually a much more common problem than is generally appreciated the, for a number of reasons. One is, oh, when my husband snores, or my dad snores, or whatever it is. It's kind of like, ah, isn't that funny? Because people don't realize that it's really is a significant health risk. I mean, it's if a person snores, severely, loudly, it's actually worse than smoking 2 packs of cigarettes a day. Okay, increasing your risk of a heart attack by as much as 20%, 20 times. I'm sorry, increasing your risk of diabetes, weight gain, arthritis, cancer. Sleep is really important, and when you don't get it, it causes health problems, right? So again, unless it's taken seriously, it's not addressed. Um, the other part of it is that often people have this idea, well, you know, maybe I have it, but no way you're going to get me to wear that Darth Vader mask, Darth Vader mask, and then I have to travel with this thing, and just like forget it, I'm not going to do it, right? Which is so unfortunate because for a lot of people, that's not even necessary. I mean, the leading cause of sleep apnea is a deviated nasal septum. Somebody had their nose broken when they were a kid, and it's affecting their ability to breathe through their nose. And so they're trying to breathe through their mouth, but they're due to the fact that when you sleep, your jaw, all your muscles relax, and your jaw muscle relaxes, and that can allow your jaw to drop back, which can impinge the airflow through your mouth and cause snoring. So again, if it's a deviated septum, get the septum fixed. Go to an ENT and get a septoplasty so you can breathe through your nose. That's the way we're supposed to breathe, is through our nose. Um, there's simple things like that. Very often people will do just fine with just a little oral appliance, which basically all it does is prevents the jaw from, when you relax, prevents the jaw from falling back and keeps it in that neutral position that it's in when you're awake. So even if you are breathing through your mouth, air can pass, right? So as simple as that. I actually think it's a much healthier way. Both of those are a much healthier way. Number one, we're supposed to breathe through our nose. That's the way we're designed. It allows the air to be cleaned and humidified and everything else. But even breathing through your mouth as it is spontaneously is much better, much healthier than having air forced into your lungs. Being trained as an anesthesiologist and having run ventilators in the ICU and things like that, we were trained that even if a person is intubated, you want to get them breathing on their own if you want them to survive. Because when air is forced into the lungs, you get areas of the lungs that are being ventilated that are different than where the blood is being perfused. So you get a mismatch between ventilation and perfusion, which can cause other, cardiovascular problems. So breathing spontaneously is always preferable. And if you can get that through having the septum fixed or having an oral appliance, much better than having CPAP or any other solution where the air is forced into your lungs.